Hello guys, so hope you're all okay, you're all enjoying your life and you're also watching my videos. I'm Dr. Arshad Nadeem Awan with my ultrasound and radiology teaching video. I have been receiving multiple messages from my subscribers and from those who are regularly watching my videos and those who are medical students that they want me to start kidney, ureter and bladder system. So in contest to that request, today I'm starting uploading their first video, which is related to the testicular cancer. Testicular cancer, in other words, is called as seminoma. It's a quite common cancer and especially seen in those who had already undescended testes. So this is a common malignant condition and disease and tumor of those who having the history of undescended testes. Beside this, morphologically, it would be similar to the germ cell tumor, and around the 40 years of life this happens. So seminoma actually has three categories, three types. There will be typical seminoma, there will be anaplastic seminoma, and there would also be spermatocystic seminoma. So far its presentations are concerned, at the time of presentation it would usually be only involved up to the testes, but in some cases, in few cases, you may be able to see retro peritoneal lymph nodes enlargement or extra nodular involvement as well. If you investigate the patients for the alpha fetoprotein, this would usually be normal in pure seminoma, and HCG would be elevated. On the ultrasound, you would be able to see a homogeneous round mass, and this would be entirely related or confined to the testes. Sometime in few cases, you may be able to see confluent homogeneous solid nodules. So this would be another presentation. In some cases, it may be able to replace the entire testes, and there may be cystic degenerative components and internals echoes. So how it will appear on the ultrasound imaging, how we will make our diagnosis, how we will write the report, and how we will confirm that. This video will include all that information. So let's start watching these images. Before going to talk about the testicular cancer, you should have to have an idea of how the testes will look and appear on the ultrasound imaging. Here on this view, you can appreciate the right and the left, both testes in view. Normally, it is recommended that you should have to have the scan of each and every single testis in a single view so that you can grab the entire idea. Look for its outline, which happens to be very smooth. Internally there will be a homogeneous echogenicity pattern. There will be no irregularity. Internally there will be no solid or cystic components, and overall this will appear as a round or in some cases slightly oval in shape. This is what the normal practice should be. You have to have a single image, and for each single testis, it's here, it's a T is noted for the testicles, and you can appreciate that the parenchyma is homogeneous and there is no irregularity, there is no intraparenchymal lesion visible in it. And beside this, you have in view the epididymis as well. So epididymis is visible and the normal testes is visible, normal outline, very smooth outline. There is no irregularity, there is no any pathology seen in the testes. So this is what you will be able to see the single testes in a single view, single image along with the epididymis, so that you can compare the echogenicity of both at the same time. It is also recommended that you should have to have the sizes of the both testes to compare with. So therefore, if in case of one testis enlarged or bigger than the other, so you will be able to notice easily. So this is what the view is. You have to take in the longitudinal section and the transverse, and then you have to have the measurement in the oblique. So this is what the normal standard of taking the testicular size is. Again, look for the parenchyma, again look for the outline, and the way we have put the caliper on. So this is for the purpose of taking the measurements in 3 dimensions for the both testes. As I mentioned in the introduction that the seminoma is one of the common cancer of the testes, there are certain characteristics you can appreciate on the ultrasound imaging. It happens to be unifocal, but many a time it may appear as a multifocal. Here in this case, you can appreciate that there are 2 lesions, 2 hypoequic lesions. So far the characteristic of seminoma is concerned, mainly it happens to be uniformly hypoequic, and it is confined by the tunica albuginea. So you can see it is within the testicular parenchyma. It is not protruding outward, it is not extending outward. So here on this image you can appreciate a hypoequic uniform mass lesion within the testicles, which is confined to the tunica albuginea, and it is not going to cross the margins or tunica albuginea. Beside this, in particularly that case being a small, so you cannot appreciate any cystic components or any fluid debris level there. However, in few cases you may be able to see cystic components or fluid debris level as well. Here another image for the seminoma. You can appreciate slightly bigger seminoma as compared to the previous slide. Here the size of the testes has been already measured, and within that there is an eccentric lying lesion which is seminoma. Look for the echogenicity. It is hypoequic. However, it is not uniformly hypoequic, but mainly to some extent in one way or the other we can call it as an hypoequic lesion. In some of the patient you may be able to see confluent lobulated mass, which I'm going to show you in the other slide, and in some cases it might replace the entire testes. So far the cystic components is concerned, you cannot see the cystic components particularly in this lesion, and there is no fluid debris. So this is a hypoequic lesion. It's in eccentric within the testicular parenchyma, and it is confined to the tunica albuginea. Now have a look to this third image. This is much more bigger than the previous 2 images. This is uniformly hypoequic lesion. However, the margins are smooth. The testicular margins are also smooth, and as I mentioned that this would be confined to the tunica albuginea. It is not crossing the testicular outline, so it will be confined to the tunica albuginea. Predominantly it is hypoequic, and there is no cystic component seen in it. There is no fluid debris seen in it, and this is occupying 2/3 of the testes. So this is another example of the seminoma. It will appear like that, and it will be a uniformly hypoequic lesion. Here in this particular image I have tried to show you 2 specific features. The one is cystic components in it and fluid debris. So there is cystic components is visible within the lesion. The second is there is a fluid debris also, and one of the black arrows also indicating minimal calcifications as well. If you pay attention to the surrounding of the lesion, not surrounding of the testes is uniform and it is normally outlined. I'm talking about the outline of the lesion. Outline of the lesion is a bit irregular, and as far echogenicity is concerned, it is heterogeneous echogenicity. However, mainly seminoma happens to be hypoequic, but in rare cases it may appear as an heterogeneous. This could be because of some lobulated nodules within it, which is not clearly visible in this slide. I'm going to show you the lobulated confluent nodules in the next slide. Here is the image which explaining beautifully multiple lobulated confluent nodule within the lesion. So this is basically what the seminoma is, and on the basis of these multiple confluent nodules, it will appear as an hyperequic or heterogeneous rather. So normally it happens to be hypoequic when there is no nodularity. When there is multiple nodularity, it will appear like that, the way you are seeing in this image, and it will appear heterogeneous. Again, I would say here the another point, it will be confined to tunica albuginea, which you can appreciate on that image. And in some cases, in a few there are few incidents where you will see that the seminoma might replace the entire testes, which I am going to show you in the next images. Here on this image, again have a look, it is about to replace the entire testes because you cannot confirm the outline of the lesion. It is deeply penetrated, it is deeply infiltrated. However, I have shown this slide in the previous images for the cystic components and for the fluid debris and for the calcification, but the worth noting point here is that it is nearly replacing the entire testes. So what I'm gonna discuss about the importance of the seminoma is that you should have to have all these points on your report. Your report should give the size, exact size, whether it is in the right or left testes, whether it is unifocal or multifocal, whether it is hypoequic or heterogeneous, whether it is confined to tunica albuginea or not, or it is crossing the outline, whether there is any confluent nodules in it, whether it has replaced the entire testes or not, whether there is any cystic components within it, or there is any cystic degeneration or debris or calcification. So I do hope this would be a worth watching video, and this will help you to examine the patients correctly and to find the testicular seminoma immediately and alert the red flag. And all these information should be on your report. So keep watching my video, keep subscribing my channel, keep sharing with other colleagues, and take great care of yourself. See you in next videos. Thank you very much.